Dr. Frezza at the Chiropractic Injury Center. Next couple of blog posts, we're going to be talking about some chiropractic. And one of the foundational things with chiropractic is something called a subluxation. Subluxation is a fancy term for misalignment. There's a lot of complex definitions of it, but simply put, the bones in your back, your neck, they all fit together like jigsaw puzzle pieces. Instead of connecting this way like a jigsaw puzzle piece, they actually interlock one on top of the other. So what a subluxation is, are when those jigsaw puzzle pieces move or jostle out of position. When that happens, there are four things predominantly that we see. The first one is pain, and just about everyone who walks through my door has that one, right? The second one is muscle spasm, and that makes sense if you think of the muscles like rubber bands. You know, when the jigsaw puzzle pieces are in position, there's not an issue, but as they move or jostle out of place, the muscle gets pulled tight or taut, just like a rubber band would get pulled tight or taut, and there's your muscle spasm. The third thing that we see is inflammation, right? So the body goes into that inflammatory state. It's why we preach ice with all of our patients, to try to help with that inflammatory flare-up. And then the last thing that we see with a subluxation is a change in range of motion, right? Does the person have a full pain-free range of motion, or is it locked, either because it's too painful to move or it just doesn't move like it should, all right? There is a fifth consideration, by the way, heat, but we're not really going to get into that one today, okay? So that's what a subluxation is. Well, how do they happen? People always ask, right? So it goes back, we do what's called a patient orientation class, and there's a couple of slides that we go through, right? Fundamentally, it can happen during the birthing process, right? In a normal birth, if the baby comes out, head first, right, they're pulling or they're tugging as the baby is coming out. The mom's pushing and they're pulling, right? So it's very easy for something to move out of position in the neck or in the low back, okay? As kids, right, we've all had rough and tumble childhoods, right, where your slips and falls and riding on bikes and falling out of tree houses and that sort of a thing. So we see it in childhood, right? We see it as adults, right? Lots of people that come into my office are weekend warriors, right? They're doing the softball or playing soccer and that sort of a thing. Slips and falls on the ice, biking accidents, that sort of a thing. Falling off their bicycle is another one. The final one that we see quite a bit is auto accidents, right? And that's a biggie. A lot of patients who come in the office have these subluxations due to auto accidents. And sometimes they can be auto accidents that are years in the past, right? Patients come in, my auto accident was 10 years ago. Guess what? I've never been the same since. I look at their x-rays and I can see, well, yeah, there's some old trauma on here. You can tell by looking at the x-ray, okay? So auto accidents is a biggie as well. The question after that is, well then, what do you do about it? How do you fix these subluxations? How do you make a change? And that's really what we're doing as chiropractors when we give an adjustment, right? What an adjustment is it's a realignment of those spinal segments. Again, they should all fit together like jigsaw puzzle pieces. So I'm going to grab my skinny girlfriend again here. We've talked about her before. This is the spinal column. So when the vertebrae are in their proper position, there's not an issue. What a subluxation is when one vertebra, like I said, moves in regard to the other. When that happens, that's when we see the pain and the muscle spasm and the inflammation and the change in range of motion. So what we're doing as chiropractors is we're going in, and most times we're doing it with our hands, and we're just taking those vertebrae and we're putting them back into position. Now, sometimes they make a pop or a snap when that happens, right? That's the crack that people always talk about. And again, it's just like the two jigsaw puzzle pieces. When you snap them back into position, there's where that noise comes from. And that's that noise that you hear sometimes with an adjustment. But what we're trying to do is basically put those segments back into anatomical alignment. When we do that, we can make a change with those four things, right? So the pain level will go down, muscles will begin to relax. If there's inflammation, along with the ice, we can get that inflammatory process to go away, and then we can increase the range of motion. So that's really what we're doing, and that's really what a chiropractor treats. We're not treating conditions, we're treating subluxations. Subluxations can cause all of these other conditions. That's what we're going to talk about today. Next blog post, we're going to get into something called gap theory, and we're going to talk quite a bit about that, but that'll be for our next video. Thanks for watching. Have a good day.